We have the next talk is by Dr. Prasanna Venkatesh, and he is going to talk to us on the connecting extra dimensional in a digital way. I gave Prasanna something little different, as he is not from the universe. He's always extraterrestrial. So it's only the dress is like an Indian dress he is wearing. Otherwise, he is supposed to be from elsewhere. Yeah, Prasanna, over to you.
Yes, sir.
Then we have two more attendees here. He doesn't know how to connect in the universe text.
Sir, they are not allowing.
ஏப்பா எல்லாம் இப்போதான் வராங்க சொல்லி வச்சிருந்தீங்க ஆடியோ சார் டாக்கு வர வேண்டான்னு. இதில் எப்படி பார்க்கணும்? சும்மா இதில்
No, no, they have to on it, sir.
இதுலேயே தெரியுமா?
Thank you, Satyen sir, and also thanks to RDR sir for this wonderful inspirational talk. I also totally agree with sir also on. I've been sir student, and I also believe in patient word to word mouth. That's how patients really come into the institution. So this is just an extra level of not the routine universal stuff that I talk. It's going to be more on if a patient is going to search for us, how can we really have our in-house armamentarium ready, like the website or like the channel. So these are things that we don't really push towards to the patient. But if a patient is trying to search for us today, the era is changing that the services have to be highlighted in our website or in our in-house hospital application. So those are some things I think sir will also agree with me, and you can also pause me at any moment, sir, and we can have a discussion. So sir is my mentor, and I would like to thank sir for all the wisdom he has given me for what I am today. Without sir, I am nobody. And thank you, sir, for that. And so digitalization of patient care. So there are interdisciplinary ideas. Can I have the pointer? So this is the digital concept that I am talking about. So today, if you see, there are many ways in which we connect to the patient. So it's not only about advertisement. So I also come from sir's school of theory that we don't really advertise, and but if the patient is going to search for us, so the patient is knowing that by word to word mouth, a patient goes and tells I've gone to this institute and they are doing a good quality care. So and then that particular patient today, the first thing they are doing is because of the post-COVID, especially the digital era that we are living in. So they come to the hospital's website and see how the website is. So these are some things. If you have a YouTube channel, sometimes the patients who are looking at our quality of care, they want to see what are the works that we are doing. So they want to make sure they go to the channel's YouTube and what is that content that we are actually delivering. And they also to an extent go to reviews. So we ourselves today, when we go to a movie or when we go to a restaurant, we are like, want to see what are the reviews of it. So these are some things that we'll have to make sure, and this is one part that you all know, but I'll just highlight on that also. So website is very, very important, my dear friends. So sometimes we don't really give an importance to the website. I think recently only at our center in Trichy, last 2 years, we had a major revamp of the website. So I really feel a dynamic website is very important. The services, what is that about us, specialty, equipment, frequently asked questions, what have we achieved. So today we talk about numbers. So I'll just go back to that. So what is that is unique about us, and the doctors of the institute will be scrolled, and you can also see there is a portal where you can type and ask any questions. It's an help desk. So patients today, because of this era of digitalization, when they are in awe of our services, that they have heard something good and they want to connect with us, we'll have to be there, as RDR sir told, we'll have to be there to respond to the patient. So again, this is not a promotion, but when the patient comes to us, what is the number of surgeries that we have done? So this is something that I recently brought into our center at Trichy. So what are the number of patients that has been consulted? So I'm a second generation practitioner, but my parents never really exposed the number of work that they did for the past 25 years of experience, because that really adds to the credentials of the organization, especially when the patients comes in search of what we have done. So we just made sure we added, ours is mainly pediatric come cataract department, along with the glaucoma that recently for the past 4 years I have brought in. So we made sure we gave the numbers of what we have really done, so that the patients will know about our team. And also you can see that this is the contact lens services that we provide. What is the contact lens aim that we are planning to provide, and what is the services that is being provided. Like you can see any special contact lenses like semiscleral lens for keratoconus. So these are some things which are very important that we feel. It's not like marketing, but we have to put it in our website so that if somebody comes in search of us, they'll be able to. And actually then we have started the in-house retinal surgical department in our institute, and recently for the past 2 years. So again we added that also, and this is the heart and science of ophthalmology. So our chief is 25 years plus, and he never really understood the need of this, because then I told him, no, it is important to share your vision and mission about the service that we are providing. So from the chairman's desk and the medical director, Dr. Meena ma'am, so I made sure that they both had a vision and mission statement from them, and what is that they were doing for the past 25 years, so the patients can actually connect with them if they come and read about their work. And why you need to choose us. So this is not like a push notification. Again, I also don't believe in it. But if somebody comes, you today you type www.mahatmahospital.org.in. So why you need to choose us? So these are the three things that we gave to the patient. So high standard of ophthalmology, committed ophthalmology team, what are our principles, philosophy, our statement, and also the modern ophthalmic equipment. So this is some kind of a passive, not a promotion, but again, it is a mission and vision that we need to say on a digital platform, which is very important that I feel. And this is the equipment that we have. Sometimes because of the marketing that is being happening, as Satyan sir pointed out, we need to make sure that we have to upload even what are the equipments that we have, so that most of the frequently asked questions are covered. You can see that we made sure that we sat with the frequent, it's a focus group discussion. I would again like to quote RDR sir here. We had a focus group discussion with the different departments, and then we made sure what are the frequently asked questions, so that we don't repeat it, or we can also have this and make sure the patient goes through this in the waiting time, so that the waiting time is also utilized. And this is our specialists. You can see that we made sure that we made the website dynamic, and we gave the exact data as what is the experience of each doctor, and what are the years of practice, and how each doctor is available during which time. So these are some things, some tips and tricks I learned from Satyan sir when he was doing his own website work, and what are the academic training that we are offering and other things. So these everybody we actually do this, but we never really actually put it on our website. So this is a very simple thing. Again, you can see that some of the patient testimonials after a written informed consent, you can have your own gallery in your website, where you can see that your patient's own testimonials, your clinic testimonials. So this is an up and running website that recently that I brought into the organization, along with the maps and other services. So this is very important, in a very practical. I'll keep this session in a very practical way, so that at the end we all will benefit. So you saw that all these 5-6 points that I am showing in the slide has been brought into the website, so that connection can be done in the patient on a digital level. So today, as we speak, you can go to the hospital website. It is totally revamped, and that is something that we brought in. Again, we do a lot of innovation work in our department, in our center called the Mahatma Center of Moving Images, which I am taking care along with the glaucoma department. So we made sure that we had a separate website for that also. So what is that we are doing? We are not promoting it, but in a way. So I'm the founder of that particular department. So what are the publications, the AI, the augmented, the extended reality? So everything you can see, these are all brought in nice snippets. Sometimes each one of us here, especially the seniors and the pioneers in front of me who are doing a lot of work, we just not tend to actually promote the work that we are doing. Also, we are doing extensive amount of photography work, innovative campaigns, webinars. So once I am part of a webinar, if I have a video today, I just at the end of the webinar, I just cut it and upload it in this particular column, so that it is just there. If somebody says they want a particular talk, we can easily take it from there and give it. So these are the 6 in this side and 6 in that side. That these are all the works that we are actually doing, but we not really tend to get it uploaded in the website, which people are actually wanting to see more about us. Once they hear about us, when the patients wants to do a survey on us before they come to us, I think this really helps us. And this is my team here, and this is the innovation departments. We have a team of 9 members, and I made sure that we also had this because now we are outsourcing for others also. So we made sure we developed exactly. And if I'm going to a conference, I'm attending a conference, presenting a paper, everything is there. It's just a single touch, you get into it, and again, it's exactly in the same area where our hospital is. So again, the YouTube channel, my dear friends, it's a very underestimated or underrated one. Every one of us will be having a YouTube channel. If we have a Google account, we have a YouTube channel. We used to do a lot of camps. So every year we actually do a cricket awareness. This year we was our 4th anniversary. We always promote glaucoma through cricket, and we had George Putran sir as one of the launches of the event this year. So you can see that every time when we do an event, I take it up to me to actually post it in the YouTube channel. And then also, if somebody wants to go and see or do a work on us, they can actually easily have this where they can touch any video. We have around 50 to 60 videos in our YouTube channel. It's not playing. Right. So this is where you can see that it's very important for you to put your channel. When I started, I never realized that I'll end up with 1.56k subscribers. But today the channel is going on well with a good amount of subscription. So that is very, very important. Again, Google reviews, as you can see, this is something that we take it very lightly, or at least I took it very lightly when I started, because when the patient is actually coming to our institute, a good patient never really goes into the Google Forms and comments good on us. We tend to miss out on those patients. It's only the frustrated patient who goes in and types something which is happening. So we just planned a station and made every patient, even good or bad, please do share this experience on the Google form, because that is very important today. That is one form which we cannot really have any control on, because it is a public evaluation system where every patient who comes in, you can tell him, you can request him politely, good or bad, please do have your opinion on Google reviews, because predominantly the bad patient or the frustrated patient, bad patient meaning a patient who had a very bad experience, they will be the one who goes and puts a negative comment on the Google, rather than a good patient. A good patient will tell to you that he's very happy, thank you, he'll even buy a sweet or something, and he'll forget to put the comment on Google. So that is very important, because usually every one of us will have a frustrated patient, a bad comment. But a bad comment, how much of good comments are there to really counter it? So that is something that is very important, because Google review today is a weapon in the hands of a frustrated patient. So that is something that we have to really concentrate on. It is in the internet, it is a universal directory, and it is a reputed thing as well. It's an online reputation today. Any product, if you see today, even the hospital, though we are doing a service, people do it. People go and browse on Google. The moment they type the hospital's name, only the Google star rating comes. So this is very scary actually. There was recently a movie called Black Mirror, which I saw on Netflix, where even persons can rate persons. When they see a person, I hope it doesn't come, but it was very alarming. They see a person, and after the interaction, they rate the person whether they are 5 stars or 4.3 or 4.2. Depending on that, there is a hierarchy created in the movie called Black Mirror. So I don't know whether it will come in the future, but hospitals today, they have it. We have to monitor the comments, because if a frustrated patient puts a comment, it is our duty to track the patient, call the patient, connect with them, and as RDR sir told, listen to them. What is that we can improve? If possible, rectify it, so that we'll not have that issue happening again. But one more thing that will work to our advantage, my dear friends. Most of the negative reviews, initially me and my sister, who is also an ophthalmologist, we were the two who were seeing those reviews and getting very jittered and frustrated. But then we understood one thing. I hope this will benefit you also. Most of the negative feedbacks that we were getting in our institute were non-medical issues. Patients were not complaining of the surgery was not well or the clinics were not well. They were telling like the toilet can be much cleaner, or the waiting time is not great, the security could be more proper, he was not responding well. So they were predominantly giving issues like maybe the OT, the wheelchair shifting can be more coordinated. So that is one personal experience that I realized, where patients were giving more of non-medical issues. So we understood one thing, okay, at least we have our medical care covered. It's not patients were not really putting comments like the quality is bad or the treatment was not working. They were more worried about the non-medical issues like accessibility, waiting time, time with the doctor may be minimal, or I could get more privacy. So we were having only open cabins. Some patients told that it will be nice if we can have a private cabin. So then we started having one unit with a private cabin. Administrative effectiveness, additional amenities like patient want a good canteen. So these were some of the comments that had in our institute. So I just thought I'll share this so it will help the others as well. The video recording is there for the neophytes. So you can see that this really matters, my dear friends. If you put a Google review today, you may see that this is a rating that the patient sees. Even when we book a Uber or a Ola today, when the ratings are slightly less, we ourselves have our own concern. And even if we see a movie today, we are worried about the reviews. We just don't really go for the director anymore. Even if it's a big director or a big producer, we still see the word of mouth. What is the review? What is the buzz? Patients are also seeing it, unfortunately. We may be in the field for 25, 30 years. I mean, my father is in the field for 25 years. That doesn't matter anymore, because what is that we are doing today really matters than the reputation. So we need to keep on working on the reputation. But this is one good thing I had when I went to the literature and checked. Patients also understand that there is manipulation in the online platform. So we don't really need to worry too much on the negative reviews, but we need to keep an eye on the negative reviews. So again, there is some organization which are faking negative reviews, but we'll have to make sure that that doesn't really happen. We don't want anybody to pull us down. That is something that was a scam, which was also reported in the literature. And apologize to the patient, very important. Patient, never hesitate to apologize to the patient if something is wrong. Even if the patient puts a comment, try to connect with him, apologize, have a team, private message him or call him as RDR sir told, and connect with them. And again, this is another one moving into a next evolution topic. Sir, I'll finish in 5 minutes if it's okay. Yeah. So this is something that I learned from my mentor, Satyan sir. You can see we published this together in Indian Journal of Ophthalmology. So when COVID happened, we had different fundus machines innovated in our department at Trichy, but this was what I learned from sir. Where can all the machines brought together? So what we did was, in this, we had the slit lamp here and the computer here. Even if you go today to Coimbatore, this is one thing that I learned from Satyan sir, where sir always has the computer very adjacent to the slit lamp, which I have not seen many doctors do. In the sense, many people use the EMR for it, but I haven't seen many people use the fundus, the OCT, the visual field examination that is being done. Of course, we do the basic examination of the patient, which is not replaceable at all. But along with this is one technique that I learned from sir, where even my diagnosis improved. If a patient like a primary open angle glaucoma walks into my OPD today, what I learned is, like, you can examine both eyes simultaneously. You can use a red free filter, you can use right eye left eye comparison, you can zoom and view. So this bilateral examination, again you can see we reduce the size, we open the visual fields, and all the different 5 visual fields are opened up. And this patient, you can see that there is a progression. So this is something that we need to use. It's called the LAN, local area network, or you can also have a wireless network. So this is something that Satyan sir and myself, we are actually heavily we are in favor of it, because we are able to improve the diagnosis better. Even in this patient, you can see a bilateral optic bit with CSR. When you have a OCT print, you will have only one frame. But when you have the OCT as all the slices that you can see here, you can keep the OCT image on side, and you can see how big this edema is in the right eye, and you can go to the left and you can see how it is in the left eye. So this is, I felt, is very, very important. And this is something also I learned. Most of my learning is from sir, as I had the disclosure on the first slide itself. So you can see sir also is highly tech savvy. He's the one who introduced me to the extraterrestrial elements. So this is AnyDesk or TeamViewer. I was shocked to see AnyDesk or TeamViewer in sir's hospital. First time when I was his fellow, somebody else was operating the computer from somewhere else. I was asking sir, what is this? Then he was telling this is TeamViewer, AnyDesk. So I would say sir as the James Bond of ophthalmology. If you go to his home or if you see his car, it's exactly like the James Bond movie, where I believe like sir may even drive the car with his smartphone. In one of the old Bond movies, there is an action scene.
Okay,
So
okay.
yes sir, sorry for that. So you can see here, this is one thing that I learned from him, where in the server you can connect the computer in the home and you can connect it. And even today, in my phone, I can connect the files that are there in the hospital. If there is a bilateral mature cataract, your retinal surgeon wants to examine the B scan files. You can see that the B scan files can be put into the server, and with AnyDesk or TeamViewer, you can actually examine this. So this was actually done even before the pre-COVID. Today, after COVID, we know Zoom, but that time it was TeamViewer and it was AnyDesk. Again, you can see the eye suit here. This is again another thing where even biometry files. So today, if there is you're out of town, you want to see the biometry files of that patient. You don't want them to WhatsApp it. You don't need to tell your assistant to WhatsApp it. You can go there, and this is a structure function correlation where in your smartphone you can go and see the structure function correlation, and you can also see this is the visual fields. We can have the fundus, how much of notch is there. We can correlate with the polar analysis, the superior notch having much bigger polar analysis loss. All this can be done in our smartphone, and we feel this has an edge over EMR. And again, this is one of the patients where you can have it in the smartphone as well. Even subtle edemas, a simple, this is a patient with again a coloboma with a subtle subretinal fluid we can see here. So this is a video that we actually recorded in the phone only, where you can see different slices can be chosen. Actually, the instrument is in the hospital. It's like a telemedicine where you can use in the phone and see the subtle SRF. So this is extensive work that we did and we published it. And we are also doing extensive work on augmented reality, which I'll skip because many people would have seen this work, where we actually have a lot of modules on three-dimensional, which my friend Aji also will be covering to you, which is a patent protected technology of ours. And we, for one, wanted to really revolutionize teaching also. So this is a video I would like to show on what is glaucoma in a single minute. Like, these are some educative videos that we are recently working on. This is a patient's own fundus image. It's a 1-minute video where you can see that we are also working on digital gadgets like learning. First, we show the increased vertical cupping, and this is my own patient's video where you can see. Then we show the glaucomatous notch. Then we slightly zoom in and show the bionetting sign. So now we are moving towards even connecting with the patients is one part. Again, connecting with your fellows in a dimensional way. The ISNT rule is breached. Then you come out and then you see the RNFL defect. Again, the structure function correlation, you can see the RNFL defect correlating with the visual fields on top, and how the structure function correlation is there. And then the same patient's OCT, the ganglion cell layer loss and the RNFL loss. So these are simple things I feel, which is very important. We make a lot of animation videos, play it up for the patient also. All are mostly self-driven content. So these are some of my slides which I don't want to repeat for want of time and want of conveying very clear and succinct information. So this is one I wanted to really highlight on one of the recent projects of mine when we started doing MAGS. So MAGS is something that is really blossoming today. And simulative learning, again, connecting extra dimensionally today, fellows are looking, especially connecting with peers and fellows today on a simulative level is very important. So eye stents are revolutionizing the way the glaucoma is being treated, or MAGS to an extent. I'm not sure whether eye stents will survive, but at least with the studies that Arvind Pondicherry is coming out, they say even post-tube and post-trab, suture GAT is really working. But they're all micro-invasive surgeries. I would like to conclude with one of these videos. So this was one of my recent case where I found it challenging why the simulative learning is very important. So you can see that once the stent is placed and when I'm injecting, I'm sorry for that. So once the stent is placed and when I'm injecting, the stent has been beautifully placed. This is a G2, generation 2 stent. It seems to be well placed. Then when I'm injecting the helon, you can see that the stent just dislodged. So these are very microscopic surgeries. Then okay, what I had to do was I just needed to ignore this. The iris was having as a scaffold. I went in and placed the second stent in that particular area, and okay, then I checked it was well. I then picked this up. I had to come out. So then when I was coming out again, I had a difficulty. It got stuck in the corneal wound. I thought I'll come out and then go in. And then anyway, I was able to recover it with good cognition and good skills. And then I was able to place the stent in the adjacent area. So these kind of surgeries demand a lot out of us. So that is when we are working on our own simulators. You can see that we started with learning simulators like teaching and counseling. Now we are moving towards surgical simulators. So this is again one of our colleagues, Mr. Tenzing, who has helped out in a lot of innovations in the metaverse. So currently this is a metaverse that we have innovated, which you can see here. This is a real time, and this is what he sees through his eyes. We have actually cracked surgical simulators in a very economical way. The same complication that I was encountering, these things can be minimized if you are actually doing a metaverse-based learning where we can orient students, fellows, when you can connect with them better by giving them this 3D spatial orientation and then having them practice on it. So, and coming to the last part of the presentation, connecting with the peers again is very important. So we do extensive work on artificial intelligence as well. For want of time, I'll skip those part and I'll just go to the peers one. So we have worked on an artificial intelligence tool to detect diabetic retinopathy and glaucoma, and me and sir did publish that in the IGO, which won the IGO Silver Award this year. So where we not only diagnose stuff, but it is also the intricate findings are also brought out. It's all for the community and for the peers. So within a minute, I'll just end it, sir. So this is one thing that connecting with the peers on digital level is very important. So peers, what they look for us in the digital level is, so this is again I learned, it's not to flatter sir because of the opportunity. It's just that I'm thankful to sir because he only really uplifted me in my career and gave me a head start. So he always told me, you look around the patient, you see for inspiration from the patient. So this happened in 2021. From one of this patient, you can see that this patient has his mask very worn very properly. The sister is taking the patient and taking the patient to a visual field. So this was happening when there was oxygen cylinder demand in the second COVID wave, and even in the first wave, this we have encountered the same scenario. The same patient, when he walks into the bowl type perimeter, he automatically removes the mask. So this was a innate patient response. When they place the head on the slit lamp or a bowl, he will remove the mask and then place it. So at that time when we were all scared, the patient blows into it, and then we had, so you can see the nose has now come out. Somewhere in between he has removed the mask. This is an unedited video. We never told the patient to remove the mask also. We just told, we are recording you, and we got the consent for it. So he's breathing into the bowl type perimeter. That is when we moved towards this virtual reality perimeter where the nose was outside, and we told that the mask behavior may not be favoring towards bowl type perimetry, whereas we can go for virtual reality perimetry because there is different way the patients are wearing the mask. So we gave a name for each configuration, and we published it in the Indian Journal of Ophthalmology also. This is very important. So we told that for time being we can use VR perimetry. Even Arvind Pondy came out with a study. Again, these are some things where when you are managing patients, you can publish those. This is an antracapsular phimosis. And important, this is one of the reason patients, a patient was on phenytoin, calcium channel blockers, and tramadol. In one of my patients had a history of bilateral mydriasis and had an issue. So make use of all your content, the awareness that we do on glaucoma, your channel, a complication that you even have when we had an injectable OIR lenses. So keep publishing all your complications also. So finally, just keep evolving digitally. Digitally, it is very, very important. And I feel on a digital platform, your projection when your patient searches for you. So this is the conclusion. Make sure digitally you are there for your patients, your peers, your juniors to know who you are. You don't need to promote yourself, but have your website, have your channel, have your publication system there. So have your department's data there. If they come in search of you, what is that they're being rated? What is your testimonials? They should know about you so that you'll be ready and you'll be able to tackle the supporting competition from people who are actually pushing out. Thank